everybody, I'm Ted O'Keefe and welcome back to another episode of America's Leading Dentist. I'm here with Dr. Allison Piper. Now, I've never interviewed anybody from Maine, so I'm so excited about this. So, in Belfast, Maine, of New England Sleep Solutions, Belfast Dental Care. So welcome to the show.
Thank you.
I want to talk to you, everyone here real quick. If you're somebody that's missing teeth, frustrated with your dentures, possibly you have a bridge or something that's wearing down, you no longer can eat the foods you once loved, possibly hiding your smile, or for whatever reason, today we're going to talk about the miracle of dental implants. We're also going to cover a really unique topic of sleep apnea, where I didn't realize this, but there's tens of millions of Americans that go undiagnosed every year who have sleep apnea. Now, what I also didn't realize was that at your dental practice, you're actually seeing patients and helping diagnose and assess patients who have sleep apnea, and you have treatments for it. I was like, I didn't realize dentists can actually solve this. So I'm gonna actually throw it in your court first. So first of all, welcome to the show.
Thank you.
Why don't you tell everybody a little bit about your dental practice, because I know you see a lot of different patients, and how you chose Belfast, Maine.
It was a little bit of a fluke.
Okay.
I ended up here ultimately to be closer to family, and also to be able to stretch a little bit more to get into a bit more of a reasonable cost of living environment than in Boston, which I lived in for 20 years.
Yeah.
So when it came time for me to make a choice about where I was going to practice, I knew that Maine really needed high quality dentists to come and help out folks, and so there's a tremendous need, and it's a beautiful area. So, and again, reasonable cost of living. So it was a great choice for me.
I love it. I love it. So let's talk about sleep apnea first, okay? Sure. Because I think this is one of the, as someone who gets to speak to a lot of dentists and work with so many great people, I think one of the biggest misconceptions is that patients and prospective patients out there are walking around with literally a life-threatening illness or disease, or whatever you want to call it, I'll let you, who don't realize it, and they don't realize that a dentist actually is on the front lines of assessing and treating. Can you, do you hear that like every day? Like, I didn't know you, or
honestly, it's not something that up until now has really been taught in dental schools, which I think is a tremendous missed opportunity. I've been in practice for about 15 years now. I've owned Belfast Dental Care for 10 years, and I've been looking at the same basic patient population for all that time, and it was only relatively recently that I started studying sleep apnea, and my eyes are just blown wide open.
Really?
At the signs and symptoms that a dentist can identify that nobody else has an opportunity to. And actually, implants and sleep apnea are actually intimately related, because one of the ways that we try to self-treat sleep apnea when we have it is that we clench and grind our teeth together, because it's all about trying to open your airway. And when you are chronically clenching and grinding your teeth to try to get more oxygen into your body night after night, year after year, decade after decade, you break teeth. So
wow, that's so interesting. Mm-hmm. Wow. That's amazing. So can I go back how did you become aware that so you were just saying it just became an awareness to you in the last year or over a year ago that you have the ability, that you could learn to do that. So congratulations on continually trying to figure out better ways to serve your patient population. It says a lot about yourself. What are some of the common symptoms that a patient might have before they come into your practice that would let them know that, oh, you may be a good candidate for having sleep apnea?
Believe it or not, it's actually snoring is a huge indicator.
Yeah.
And it's it's kind of logical if you think about it, because all sleep apnea is the soft tissue in the back of your throat and the back of your tongue end up touching each other and blocking off your airway.
Okay.
So what is snoring other than the soft tissue at the back of your throat and your tongue vibrating against each other? So that's all snoring is. It's not, that's all it is.
Is that right?
Yeah. So if your anatomy is such that that's already happening, then it's fractions of millimeters before the tissue connects so much that you don't get oxygen. 80% of people who snore actually have sleep apnea.
Wow.
And I mean, that's kind of shocking.
Yeah.
And I didn't even really think about it before, but if a patient comes into my office and I look in their mouth and I see that they have all the symptoms of clenching and grinding, their teeth are worn down, they have little pits in their teeth because possibly some acid is coming up into their mouth, because when their throat gets blocked off, their body is trying to get them oxygen. So their diaphragm is pumping, sending acid up into the mouth. So people have like a lot of acid reflux issues frequently when they have sleep apnea. And then I look at their tongues, and their tongues have, it's called scallop tongues. There's these little ridges on their tongues because they're trying to shove their tongue forward, and it literally leaves indents in the side. That can be an indicator. And then if I look at the health history form, and there's high blood pressure, acid reflux, anxiety, depression, frequent nighttime urination, and frequent is once or twice or 3 times a night going to the bathroom. That's actually not normal. I think that people think that it is.
People do think that's normal.
Yeah, it's and so did I actually. I'll go more into my own story later, but because I ended up being diagnosed with mild sleep apnea, and I just thought, I'm getting older, drinking water.
This is what happens. Yeah, this is what happens. That blows me away too, because I felt the same way when I was hearing about that. Okay, so but what is the danger? Like, so beside, like, what is real? Like, why is it so important that if someone's watching this and they're like, holy cow, she just described me, even parts of that. Yeah. Why is it so important that people get treatment? And then my secondary question is, how do they get treatment?
Well, it's if you think about it, you can live without food for weeks or months. You can live without water for days. You cannot live without air for very long, right?
Yep.
So our body goes into kind of crisis mode when we don't have enough oxygen.
That's a great way of putting it.
So when you're you're not breathing very deeply when you're sleeping. You're in kind of like a mini hibernation. So if you think about it, you're breathing very shallowly, and then your throat gets closed off. There's not a whole lot of reserves of oxygen in your lungs for your body to be drawing from. Yeah. So your brain says, oh no, I'm not breathing, and starts to send all sorts of cascades of hormones through your body that cause all sorts of problems. It sends signals just like you were running to you need more oxygen, so I'm going to make my body do this, and yet your airway is blocked. So your diaphragm is pumping, which is sending acid up into your stomach. Your heart is going into overdrive. So over time, parts of your heart can enlarge, parts of your cardiovascular system can become damaged, and it happens incredibly slowly. It's all these things that we don't notice because of the slow pace of damage.
That's right. So you have where people think of, they're over 55 or 60, high blood pressure becomes a little more normal. But what you're sharing and what I'm learning by studying this topic is all those micro crises every night are sending all these adrenalines and different hormones that the body's not supposed to be getting at that time. And so then cortisols, thank you. And then all of a sudden you have the heart's enlarging, you have less oxygen, so it's got to speed up, push oxygen out, which increases your microclotting possibility, which is a stroke, everybody.
Yeah.
Oh, wow.
And higher risks for dementia as you age.
Yeah.
And it's these things Obstructive sleep apnea is a chronic condition, meaning that it's not going to go away. And it's also progressive.
Yep.
So it will get worse over time. None of our tissue gets more firm as we age, unfortunately, as we all know. So it will get worse and worse and worse over time. Something that I feel very passionate about is making sure that we're treating obstructive sleep apnea in the earlier stages. If people like dismiss, oh, well, it's just mild sleep apnea, so I'm not going to treat it. It's just mild or moderate, I'm not going to treat it. Why would you possibly put off vital health care until it gets worse, right? Until your cardiovascular system is already damaged, until you already have done really irreversible damage to multiple systems in your body that never had to be done. And again, because people aren't very aware of it, they don't know how it's impacting their daily life. And it tends to, these things, as we age, we also are having children, we're getting more into our careers, that sort of thing.
Yes.
So we feel like, well, of course I'm tired because I have teenagers, or of course I'm tired because I have this high-powered job. And so you counteract that with caffeine. You do the things and you just kind of go through your life thinking that things are normal, when actually you have an underlying health condition, as well as all those other complicating factors that we all have to deal with. That if you see it, if it gets assessed and diagnosed through the proper channels, is very easily treatable.
Okay, this is amazing. So what I understand is that when most people think of sleep apnea, they think solution equals CPAP. But 74% of people, or 75% of people who go that route, just can't be compliant. They don't like it. They don't like how it feels. Doesn't feel good, so they're not compliant. So CPAP, I'm chuckling, but it's not funny, goes back on the shelf, and they just kind of go to learned helplessness of like, well, this is just going to be the new normal. Sleep in a different bedroom, whatever it might be. But there's different solutions. Can you share like how, if somebody wanted to come in and see you and see how you can help them with, if they were CPAP not compliant, there is hope? Can you walk us through how that process might work?
So what CPAP stands for is continuous positive airway pressure.
Okay.
And what we're trying to solve for is the collapsing of the back of your throat. So what CPAP does, it sends air through the back of your throat to open it up. But what we want to do is open it. We don't care whether or not it's air or anything else. So what a general dentist like myself can do is we can make custom fabricated oral appliances that interlock and can bring your lower jaw forward. You don't have to bring your lower jaw forward a foot and a half. You just need to bring it forward a few millimeters. That's all that we need to open our airway and to get the oxygen that we need. Good custom oral appliance that fits well, that stays in, that doesn't once you get used to it, you can't live without it. It's a very straightforward treatment for people with mild or moderate sleep apnea. It works in well over 90% of the cases, and even people with severe sleep apnea. Not only are they successful, and I believe it's 80 or 85% of the cases, but it sure as heck is a lot better than the 0% when the CPAP is sitting in your closet.
That's right. Right. Or you feel like you're a failure because of it, where you don't have to. That's amazing. Let's talk about two things. One is, you said you were going to share yours. Did you?
Yes.
Okay.
Yes. So again, I never really thought about sleep apnea at all, really.
Yep.
And then just searching around for some continuing education. I also get exposed to new information. So, sleep apnea, I guess I've kind of heard talked about in the dental world. Why don't I check out this seminar? So I started training through the International Academy of Sleep, where I saw their a webinar, introductory webinar of theirs. I found it very intriguing. Followed up with that and traveled to Orlando for a training. Got really intrigued, seeing how many people who already exist in my practice, and then who exist in the state of Maine, who could really be helped by identifying and then using these treatments. A friend of mine is a nurse practitioner in the Belfast area, and I sent her a text saying, "Hey, is sleep apnea actually an issue in Belfast? Like,
Wow.
should I be checking this out?" And she said, "Absolutely.
Is that right?
There's many patients of mine that are non-compliant with CPAP."
Oh my
And
gosh.
so that kind of, well, this is something worthy to pursue. So then I started learning more about it, and I've become very passionate. I actually think that it's some of the most important work that I do because of the wide-ranging effects that having sleep apnea causes in people's lives. Even just, feeling run down all day. That's just, nobody wants to live that way. And then when you find out like just how sick it makes you over time, it's very concerning. So I just turned 50 this past year, so I have been getting the elbow myself at night a little bit more often. Can you sleep on your side? And I got kind of annoyed by that, being woken up repeatedly through the night, getting 100%. The elbow. And so I realized, I guess I am snoring. And again, I'm a very busy professional. I have 9 and 11-year-old, so I just assumed that my fatigue through the day and my excessive coffee intake was just what I had to do. I just presumed that the couple of times that I got up to go to the bathroom at night, I didn't think anything of it. I just thought it was life. And so I ended up taking a home sleep study myself, and I did come back as having mild sleep apnea. So I got an official diagnosis through a board-certified sleep physician, got a prescription for treatment, and I'm now wearing one of the appliances that I provide to my patients. And there's so many things that dentists are being solicited to learn about and offer to their patients, and I want to do right by my patients.
100%.
I really, really do. And so when and you always get a little bit skeptical because you know that like everybody's out to make a buck or whatever, but like I'm very, very pleased to say that oral appliances actually work. They totally worked for me. It's extremely rare that I go to the bathroom at night anymore, except like if I go to a restaurant and the waiter's like constantly giving me water.
Sure, we got that one,
right? And I absolutely feel better through the day, and I don't get the elbow anymore, so my partner doesn't have to suffer through secondary sleep apnea either, right? So it's this, and then I'm in a better mood at work, a better mood for my kids, so it's really great. And kind of the most important thing for me is that there's a pretty significant cardiovascular illness history in my family. My mother has atrial fibrillation, had to have a pacemaker after an ablation surgery went wrong, and 91% of people who have atrial fibrillation, AFib, have sleep apnea. And my mother
Dude,
and
that is crazy.
It is totally crazy.
That is nuts.
I'm an apple that did not fall far from the tree.
Wow.
So my hope is that I've avoided a lifetime risk of serious cardiovascular disease and dementia too. And I don't know. I see enough patients with dementia. I'd really like to avoid that if I can.
I mean, that's heartbreaking on that. Yeah. That's pretty amazing. Well, either way, you're taking a proactive approach to it versus being like 20 years down the road.
Yeah, waiting till you get sicker.
Hopefully,
You don't have to do that.
So this is amazing. So I want to switch gears just a little bit, talk about dental implants, okay? Please. So I love talking about dental implants. I think when people have their teeth back and they get to eat the foods they love, you just see a different person to see the smile. So tell me about what are you doing in the office? Do you place the implants in-house? Do you mind sharing with our group or our audience, like just why you started placing your implants, who's coming into your practice, and what are you seeing?
When I first started down the road of becoming a dentist, I shadowed as a dental assistant at Boston Healthcare for the Homeless. And the first time that I assisted on a surgical extraction case, I was in the middle, like holding the suction for the doctor, it started getting gory, and I had to hand the suction off to my colleague, walked out the door, and dropped to my knees, and almost had like a total pass-out vasovagal response, right?
Yeah, you almost
never.
Or no.
Almost passed out. So
I love it.
Fast forward, 20 years later now, I have found, I don't know exactly what happened, but I am a really excellent surgeon. So I was able to get over that threshold, and I'm able to provide comfortable, fast surgical procedures in a way that is a tremendous relief to my patient. There's so many times that patients come in and they're super scared, and like I'm done before they even think that I've given them a shot.
Is that right?
Yeah. So it's I don't know why God gave me that skill, but I've got it. So I got to take advantage of it. And kind of a similar. There's so much that you have to learn in dental school. They definitely touch on dental implants, but it's something that most general dentists have to pursue outside of dental school and their continuing education. So about 5 or 7 years into my practice, I started getting intensive training in implants and bone grafting to help people who don't have enough jawbone to be able to place implants. And it's been great.
And what's encouraging there, I just want the audience to know, like, so if you've been told you are not a candidate years ago and you've just had to wear non-attached dentures that rub and don't allow you to, you can't eat the foods you love, maybe you're self-conscious when you're out in public, you don't smile as big, don't laugh as hard. What else are you seeing when people come in? Like, how do they know they're candidates for dental implants? Like, are they missing teeth? What do you see in your area?
Certainly. I think that over the past 5 or 10 years, there's been a lot of information that has become available for patients. So it's a more commonly acknowledged treatment possibility. So frequently people are coming to ask me about it. But whenever anybody is going to lose a tooth, they have 2 options: to either replace the tooth or not replace the tooth. And if they replace the tooth, they have a choice of replacing with something fixed like an implant or removable like a partial denture. And nearly everybody would prefer an implant over anything removable. So I discuss all possibilities with the patient and let them know the pros and cons and talk about their individual situation and needs and come up with a solution that works for them.
Yeah, amazing. So I want to talk about pain again because you brought it up. So my understanding is that it's a misconception because when people see like videos online about like dental implant procedures, dentists should not post like pictures of the surgeries because they look worse than they are. There's no nerves in the bone, is that accurate? Or what?
Limited nerves.
So it's not as painful as like an extraction is actually more traumatizing is what I heard.
It certainly can be. I mean, one hopes that they try to do extractions as untraumatic.
Not when you're at Dr. Piper's office. There's nothing traumatizing. Isn't that great?
You don't have to get as profoundly numb for implant placement as you do for extractions because there's not as many nerves. There's a direct nerve connected to a tooth. It's more spread out in the jawbone. Yes, and I think that when you go to a practitioner who is experienced and knows what they're doing, the timeline for placing the implants is very reasonable, and the recovery afterward, over and over again, I hear, like, I didn't feel anything afterwards. I barely had to take any pain medication. You need to go to somebody who knows what they're doing and treats you right.
What's the most common response you get from patients when they come back to you, like on their recheck after they have their new teeth?
I think being surprised that everything went so smoothly. They were expecting, and that happens throughout the whole process. For me, again, I feel very lucky that people are expecting the worst. then they come in, they're treated like family, they're treated like people, they're not treated like a number. And on each step of the way, we do everything that we can to make them comfortable and for the whole process to be successful for them.
Yeah, I love it. I love it. Let's talk about, can we talk about money for a minute?
Sure.
Because usually when we talk about dental implants, we think expensive. You know, those are kind of go hand in hand. So do you mind give us a range of like either, or how does your office handle helping people afford it as far as like whether they can get financing, payments, and just give me a range of costs on that.
For dental implants, the ballpark that you can anticipate is about $5,000 to $6,000 per implant.
Okay.
That does not typically have to be paid up front. Sometimes we'll offer a upfront payment discount, so that can be very nice for people who do have access to that kind of cash. But it's what I like to remind people is that the existence of dental implants is actually fairly miraculous. We are replacing a body part. We are removing a tooth. We are tricking your jawbone into thinking that it broke a bone rather than lost a tooth.
Oh, wow.
And so you have a tooth root shaped hole in your jawbone. You need to give your jawbone time. You're not expecting you break your leg that your leg is going to be instantly healed. We need to give your body optimally time to heal. Then we need to place the fake root, the dental implant in your body. We need to give your body time to integrate into the implant. And then you can put multiple things on top of the fake root depending on which path you're going to go down. If you need a single tooth implant, replacement, if you need a bridge which can replace multiple teeth on fewer fake roots, so that can be a cost savings. Or if you're in the circumstances that for whatever reason you end up losing many or all of your teeth, there are various denture implant retained or implant supported denture options that can replace all of your teeth in a manner that's as close as possible to your natural dentition.
Right, and you know, I think one of the misconceptions people have is like, oh, I'm missing my teeth, I have to, like, one implant multiplied here. But no, what I'm understanding is you can have a certain number of implants and just have a fixed arch. Is that correct? Or something like that?
Yes.
So how many implants approximately would I need for something like that?
It can really vary,
right?
It can vary by situation. The most affordable solution is 2 implants placed in your lower jaw. If you've lost all of your lower teeth and you've been wearing a denture and you've been suffering, you're never able to wear it, you can't eat what you want. It really is a game changer to place 2 implants and have your denture snap onto those 2 implants, because then your lower denture will stay put. Although obviously it's not ideal to have a complete upper denture, many people who have limited financial means can, like, well, I mean, my upper denture's okay, don't love it, but I can deal with it. But the 2 lower implants to snap onto are a game changer. In terms of the quality of your life. In order, if you really hate dentures, you lose proprioception, you lose the feeling at the top of your mouth, so the way that you eat changes. You lose some level of taste when you have the roof of your mouth covered, or you have a lot of your tooth surface or a lot of your gum tissue covered, you have to take them in and out. A lot of people have, like, my grandmother ended up in dentures when she was 19. So like my whole life I would see her like taking her teeth out at night. And so a lot of people are like, I do not want to take my teeth out at night. I do not want to take out my teeth at night, and I will do whatever I need to do in order to not do that. Then depending on the bone situation, depending on how much stability you want in them, 4 or 6 implants can be optimal. And then again, depending on how much bone you have, you can either fix that denture to the implants, so you never take them out, or they can snap on more sturdily too, if that ends up being the right case for you. But through all of those, there's not a whole lot of people who can afford to just plunk down that kind of money at once. So there are many financing options available for folks. Again, we typically spread it out over time. and it becomes another payment that they are able to fit into their life and lifestyle. Because it's something that they value and adds to their quality of life. Like
I'll tell you, like if someone is just struggling and they're dealing with it and they're just trying to muscle through it, like you're already paying the price.
Yeah. You're
paying the price right now. So they can come in and find out what's the affordable payment options that would work, and then that's amazing. So hey everybody, so if you're out there and you're listening to this and you're like, Dr. Piper's talking directly to me, whether it's with my dental implants, I've been missing teeth, I'm wearing a partial full denture, and it's just enough's enough. Do you offer free consultations, or how does your office work? So
absolutely.
Just give the office a call, or
please.
And when you watch this video, I'm sure there's a link somewhere below or above or inside comments that you could click on and take you to the website. And also, we talked about sleep apnea. So if that conversation struck a chord, I imagine you do free consultations for that as well?
Yes.
And so no pressure, no risk, no obligation. Nope. But find out what's possible for you. So is there anything last you want to share with everybody in your area?
We want to make this attainable for people. We want to be able to have them happy and healthy. And there are many ways, including if your so sleep apnea treatment is covered by medical insurance.
Oh yes, we want to talk about that. Yep.
Yeah, if your health conditions have led to the loss of your teeth, if you have had trauma and that has led to the loss of your teeth, medical insurance actually will pay for some dental procedures if you're working with the dental office that knows how to do it. And my office is dedicated to maximizing all of the avenues to make this treatment possible for you. So
and not everybody does that. That's unique. That's pretty amazing.
It's pretty uncommon. Because I mean it's medical insurance. Oof, that's
I know, right?
Their system, but it's worth it.
Well,
it's accessible.
Well, I love your drive. I love your commitment to your patients. I love that you're, I think you said you're 50, but you look 35 to me. And that you're committed to your patients and you're doing all these amazing things for them. So thank you.
My patients are my neighbors, so you got to take good care of them.
Yeah, that's right. Well, thank you so much for being on the show. And thank you, everybody, for watching. So, hey, if you're in the area around Belfast and you want to come visit Dr. Piper and see how they can improve the quality of your life through the different solutions they have there, please give them a call. And thanks for watching the show, everybody. Take care.